a woman or a girl who is sexually active from a very young age or an unprotected sexual intercourse with multiple sexual partners are the most common risk factors for the cervical cancer. Now, cervical cancer, the risk factors are around 80% of the women will have HPV virus in them in a lifetime.
Is cervical cancer curable?
Any cancer.
Today we are honored to have amidst us Dr. Sharon Ruskina. Dr. Sharon is an experienced gynecologist with over 15 plus years of experience. Currently, she is an obstetrician and a consultant gynecologist at Mangalore Heart Scan Foundation, Bangalore. And yes, she works on providing comprehensive care to patients and educating patients regarding cervical cancers, etc. And yes, today she is with us to give us a brief insight into what cervical cancer is and what the HPV vaccine is. So yes, a warm and hearty welcome to you, dear doctor. Thank you so much for joining us today.
Thank you.
Okay, so what exactly is cervical cancer and what are its risk factors?
Yeah, cervix is the opening of the uterus. So a woman has a uterus, has two tubes and two ovaries. So the opening of the uterus, or we call it as the mouth of the uterus. So that is called the cervix. So in women, we have, especially related to gynecology, we have various types of cancers, in which cervical cancer was one of the most common cancer which was seen. Now, over the last 5 years, we have seen breast cancer taking the number 1 position and cervical cancer being number 2. Then we have the ovarian cancer and the uterine cancer, then following the other vulval or vaginal cancers. Now, cervical cancer, the risk factors are mostly related to sexual transmission, sexually transmitted cancer. So a woman or a girl who is sexually active from a very young age or an unprotected sexual intercourse with multiple sexual partners are the most common risk factors for the cervical cancer. So the symptoms being of the cervical cancer is like she'll have intermenstrual bleeding, or she'll have heavy flow during her menses, or bleeding after coitus or sexual intercourse, or like maybe foul smelling vaginal discharge. This is the most common early symptoms that we can detect in cervical cancer. Then the other symptoms varies, like pain abdomen, she'll become anorexic or she'll lose weight. All these are other symptoms.
So when should one take the HPV vaccine, and even if they take the HPV vaccine, what are the side effects of it?
So first, we have a vaccine now. Like not all cancers are prevented. We know that, like through a vaccine. So we finally have a vaccine to prevent cervical cancer, also to prevent like anal cancers, throat, mouth cancers, all is prevented by this HPV vaccine. So what is this HPV? That is the first thing. It's a human papilloma virus. It's a virus. So this virus enters into the body only through sexual contact. Okay, so we are having a vaccine which helps to prevent this virus from growing or prevent virus from entering into the body. So this vaccine is recommended for girls and boys. From the age of 9 to 14 years, we have 2 doses, and from 15 to 45 years of age. The same schedule even for the boys. And you asked me what are the side effects?
Yes.
Yeah, there are no side effects per se related to the vaccine other than like redness, itching, or some sort of like allergic reactions, or if you are allergic or anaphylactic, you have some certain body reactions, then you might face it. But it does not have particular any side effects or anything related to this vaccine.
Okay, so let's say a person is sexually active. So can that person take the vaccine if he or she is sexually active?
Yes, even if you are sexually active, we definitely recommend this vaccine because there are different types of HPV strains. There are 200 varieties of strains. So once a person is sexually active, not all the strains that she or he will be infected. So once you give the vaccine, this vaccine helps to prevent the growth of the other viruses and also prevents it, from cervical cancer. Okay. So we definitely recommend, even if you are sexually active, definitely to take the vaccine.
Okay, so let's say that a person already is affected by HPV. Okay, so should he or she take that vaccine?
Yes, definitely. Even if you are infected. See, around 80% of the women will have HPV virus in them in a lifetime. Most of the time, this virus gets resolved or goes out because of your improved immunity. And not all these HPV viruses can cause cancer, is it? So it will take time for the body to get over. So even if you have an HPV and once it's detected, then it is treated. And then we definitely recommend for HPV vaccine.
Okay. So what screening tests are done to detect HPV virus?
Even if you are taking the HPV vaccine, we definitely recommend the screening test as per even if you have not taken. Okay, now screening for the cervical cancer starts from the age of 21. Okay, as a recommendation, from the age of 21 up to the age of 65 years of age for a woman. So there is something called as pap smear test. That is a screening test called the pap smear. It's an OPD procedure where we just take the cells, smear it on a slide, and we give the report in 24 hours. Okay, that will just help to detect if you have an inflammation cells or you have a precancerous cells, whatever. In case we have a doubt that she might be having cancer, then we don't do a pap smear, we directly do a biopsy, something called a cervical biopsy. Then we have another test called the HPV DNA test. Okay, it's HPV DNA where the testing is where we detect the HPV virus. So that test is a little more advanced test where we do an HPV DNA test. So once the HPV DNA comes negative, like she is not having the HPV virus, then we recommend to do the test once in 5 years. If it's a pap smear test is negative and she doesn't have any cancer cells or any inflammatory cells or anything like that, we ask them to repeat after 3 years. In case we detect something, then we treat them and we'll ask them to follow up maybe the next year.
Okay, so can you now elaborate about the doses of the vaccine?
HPV vaccine is recommended for girls above 9 years of age. So between 9 to 14 years of age, we recommend 2 doses. That is, if you're given the first dose, that is called the 0 dose, and the second dose is given after 6 months. Now, from the age of 15 till the age of 45 years of age, we recommend the vaccine as 3 doses, like 0 dose, 1 month, and after 6 months.
Okay, so is cervical cancer curable, or is it like a long-term disease?
See, any cancer depends upon the stage of the disease that you detect, right? So the treatment modalities are well advanced now. So if it's a very early stage, there's a surgery, and a little more advanced stage, we have chemotherapy followed by radiotherapy. We have different types of like radiation types of therapy. So they have a very good outcome. So patients definitely live longer with cervical cancer because the modalities are good, and it depends upon how the person takes up the treatment. It all depends upon how early you're detected and how well you go through the procedure, like treatment rather.
So who should avoid taking HPV vaccine? Is there any criteria such?
Definitely not recommended for pregnant women because there are no large studies to detect the safety in pregnant women. So definitely pregnant women is not recommended. Second is anybody who's having any allergic reactions, like if you have a common problem with allergy or anaphylactic reaction to certain food or something like that, then definitely we do not recommend to take this vaccine. But otherwise, anybody can take this HPV vaccine.
Okay, so what other cancers can HPV prevent?
Yeah, it's mainly for cervical cancer in women, but it also helps to prevent other genital warts. That's not cancer, warts like in infection eruptions that come in women. Cervical, like vaginal warts, vulval warts, anal warts. Even in men, there are a lot of penile, scrotal, anal warts. It also helps to prevent from vulval cancer, the vaginal cancers, throat or back of the mouth. Those cancers can also, HPV vaccine helps to prevent.
Does HPV vaccine affect the infertility or the ability to conceive?
No, it has nothing to do with fertility at all. Now, if a woman is planning to conceive, maybe she can take the vaccine and then continue her, she can plan for pregnancy. But if during her, like she has conceived and she has just taken the first dose, then definitely we'll withhold the other doses and she will continue with her pregnancy because pregnancy is given priority, and maybe she can take that vaccine later once she starts feeding or something like that. But it definitely doesn't affect your fertility or future pregnancy outcomes, no.
Okay, doctor. So we've cleared almost all of our queries, but I'm sure that some of us might have more queries. So if at all they have queries or would want to reach out to you, so could you please tell us where and how they could reach out to you?
Yes, I'm available at Mangalore Heart Scan Foundation, MHF at Bendur, which is my clinic opposite Kolasa Hospital. I'll be there for consultation in the morning between 9:30 to around 10:30, 10:45. Then maybe at around 12 to 1:30, and in the evening after 4 to 7 p.m.
Okay, so where is this vaccine available? Where can one go to get this vaccine?
Yeah, the vaccine is available in all the hospitals,
Okay.
but it's available at my clinic at MHF.
Okay.
So if you take an appointment, we can schedule it according to the time,
Okay, all right.
and then it can be given.
Okay, so if you want to get the vaccine, then we can visit MHS.
Yes, definitely.
All right, yeah. Thank you so much, doctor, for being present here today and for sharing your insights on cervical cancer and HPV vaccine, the side effects, and why one should take the HPV vaccine. I'm sure that most of our doubts are cleared through this interview. So yes, thank you so much, ma'am, for joining us today.
Thank you.